Today our topic of discussion is on the myasthenia gravis. See, myasthenia gravis. This myasthenia word is a Greek word in which myas means muscles and asthenia means weakness, whereas this gravis word is a Latin word and it means serious. So we can say myasthenia gravis is a serious disease in which there will be a weakness and a rapid fatigue of the muscles, but under the voluntary control. And this disease, so this disease is a condition which is caused by a breakdown in the communication between the nerves and the muscles. Clear? Or you can say this myasthenia gravis, this disease is a long-term neuromuscular junctional disease that leads in the varying degree of the skeletal muscle weakness. Now, what is skeletal muscles? The muscles that controls the bodily functions and movement. Clear? So, the most commonly affected muscles are those of your eyes, face, and this following, and it can result in the double vision, drooping eyelids, trouble talking and trouble walking. There will be a fatigue and difficulty in breathing also. So myasthenia gravis is a neuromuscular disease characterized by the considerable weakness and abnormal fatigue of the voluntary muscles. We can say the defect in the transmission of the nerve impulses at the myoneural junction occurs especially. Now, what are the main causes of this myasthenia gravis? See, myasthenia gravis is caused by an error in how the nerve signals are transmitted to the muscles. It occurs when the communication between the nerves and the muscles is interrupted at the neuromuscular junction. Now, neuromuscular junctions are the junction, or we can say are the place where the nerve cells connects with the muscles they control. Clear? So we can say the causes include insufficient secretion of acetylcholine, excessive secretion of choline, excessive secretion of cholinesterase, and unresponsiveness of the muscle fibers to acetylcholine. Clear? Next, we will discuss about assessment, how you can assess this disease. Clear? Here you can see there will be a weakness and fatigue in this disease. Rapid fatigue will be there, difficulty in chewing, dysphagia will be there. Dysphagia means difficulty swallowing. Ptosis here you can see in this image, abnormal low lying or a drooping upper eyelid is known as ptosis. Then is diplopia. Diplopia means double vision, or you can see in this disease patient seeing two images of an object. Then weak and hoarse voice, difficulty breathing, diminished breath sounds, respiratory paralysis and failure will be there. So here you can see in this image there will be a smoothing out of the forehead, eyebrow drops, there will be drooping of the corner of the mouth, and the first noticeable symptom is the weakness of your eyes, eye muscles. Difficulty in swallowing, slurred speech may also be the first sign. The muscles that controls the eyes and eyelid movement, facial expression, chewing, talking and swallowing becomes weaker in this disease. So the muscles that control the breathing and the neck, limb movements can also be affected in this disease. So this is all about its assessment, how you can assess with the symptoms. Clear? Next we will discuss about its intervention, what you can do for that. First of all, monitor the respiratory status. As we discussed, there will be a difficulty in breathing there, respiratory paralysis will be there. So you have to monitor the respiratory status and ability to cough and deep breathe. If the patient is able to breathe adequately or not, you have to assess that. Monitor for the respiratory failure. Maintain suctioning and emergency equipment at the bedside in case of emergency. Monitor the vital signs. Monitor the speech and the swallowing abilities to prevent aspiration. Encourage the client to sit up when eating. Assess muscle status. Instruct the client to conserve strength. Next, plan short activities that coincides with the times of maximal muscle strength. Monitor for myasthenic and the cholinergic crisis. Administered anti-cholinesterase medications as prescribed. Instruct the client to avoid stress, infection, fatigue and over-the-counter medication. Instruct the client to wear a Medic Alert bracelet. Here you can see this is the Medic Alert bracelet. It's a nice and a simple solution to have a health details accessible via a band. Via this band, especially for our older families. Clear? So, this is all about its intervention. So, today we have discussed about Myasthenia Gravis, what are its causes, and we have discussed about its assessment, how we can assess this disease and what are its interventions. So I hope today's video is clear to you all. Thank you.